Okay.
There we go. There we go. Okay, now can everyone see the slide deck? Apologies.
No, unfortunately not. There it is.
Dang, a little slow on the uptake. Okay, so.
Yes, it's moving.
All right,
Perfect.
there we
Thank
go.
you.
So thank you, Chloe, appreciate that. So we've gone through the topic slide. So moving into the process. So the existing, we were talking about the existing vendors at this point right now. So on April 8th, the quick reference guide that should help walk you through the process for the testing was posted on the Pennsylvania website. April 15th. On April 15th, all existing vendors that are submitting visits for the PCS program or were certified dating back to September of 2019 will get an email from the support team at Sandata. And that email will contain the testing checklist and all of your credentials that you need to begin the process for recertification. Again, August 10th is an important date because that is when all new changes will need to be updated for the alt EVV certification. So if you're not recertified by this point, highlight in blue, emphasize in blue that if you've failed to begin the process or complete the process, that you could end up having file rejections that could also affect your provider agency's claims. Okay, again, emphasize that on August 10th, when the enforcements begin, that failure to retest or recertify will result in file rejections, and PCS claims can deny, after August 10th of 2022. So it's very important to respond to that email. And we'll talk a little bit about that process in the next few slides. New vendors, for new vendors that haven't been previously certified, again, the QRG document is a different document. Again, notice that this is a new vendor certification versus the recertification. That was posted on the DHS website as well too. And then on April 15th, new providers, and I underlined the providers, can begin an online enrollment process, and we'll give you those details in the next slide here. But your providers need to kick off that process, and we'll talk a little bit about that momentarily. And again, same thing, August 10th, if a new vendor is part of the PCS program and is looking to submit visits for both PCS and HHCS come October 10th, you could be subject to file failures that will affect any of your PCS clients' claims. So again, important dates in the blue, so please make sure that you're following those timelines, please. So moving to the new providers to the LTVV process. So this is going to be kicking off to any new provider. If you're not providing any EVV services and you're brand new to the program, a link in an online link is going to be available for you on the Pennsylvania website April 15th. That link is going to ask you to fill out some enrollment questions. It will be posted on the DHS website, and here's the link for the DHS website. It's not available now. It will be on the 15th. Providers need to go in, fill out the provider details along with who your vendor is, and that will begin the process of providing you credentials. You'll get a support email that will respond to you from the support@sandata.zendesk.com. And that support email is going to provide you one of three responses. The first response is A, your vendor is certified and we can issue your credentials. That'll occur within 5 business days. B, the second response you're going to receive is your vendor is still currently testing to be recertified. So your vendor is still, going through the process, and what'll happen is that once they get done, then the credentials will be created and provided to you. All right, and then C is the last one. Your vendor is new to the DHS program, and then Sandata is going to take that information that you provided in the online enrollment form and contact your vendor directly. Okay, so 3 responses. Your vendor's is completed certification. Here's your credentials. Second response is your vendor's still testing. So just hang tight and we'll get you your credentials momentarily in the next couple of days when your vendor completes it. And then C, your vendor is new to us and we'll send out some credentials to them. Okay, moving on to the recertification process. So for those vendors that are currently in the program right now, who need to recertify, your vendor, your credentials and your testing information will be provided to you in an email on April 15th from SanData Support detailing the process for recertification. The certification email is going to contain the testing instructions, testing credentials, testing checklist, and so on. Okay. Then the vendor is going to perform their own self-paced testing and submit completed testing checklist to the support team in the same email that you received the testing checklist. The support team from Pennsylvania, EVV, will email the vendor indicating if the vendor checklist passed or needs additional work. And you can refer to the QRG that's pictured on the screen, as well as any of the document links that are in the slide deck, if you have any questions. Also, as a note, if you have multiple contacts within your vendor agency or your vendor that has been working with Pennsylvania support, we will be emailing those credentials to all of them. So if you've got one person, one vendor contact, or you have 5 vendor contacts, all of them will get the same email. You will all be able to see that you all received that email. So if you didn't get it, double check to make sure everybody else in your team did not get it, just to be on the safe side. So if you didn't get it, see if somebody else in your vendor agency received the email, just to be on the safe side. If not, then reach back out to us on Monday the 18th to ask where your credentials were, your testing credentials. Lastly, the new vendors, again, vendors who are not certified in the Pennsylvania program currently, there's all the links and information that you can go to for information to assist you. But again, once you're, once a new provider has enrolled with Pennsylvania, then we can begin testing with you. As I mentioned on Friday in the public meeting, if you don't have a provider enrolled in the Pennsylvania program, we cannot begin any testing with you. So that enrollment form that I talked about in 2 slides ago is very important to start the process for you. Okay, so your provider fills out the enrollment form, and then we can contact you based off of that enrollment form. So again, your process is a little bit different than the recertification process, but again, it's all spelled out for you in the quick reference guide for new vendors. Okay, and you must also pass the testing credentials and pass the checklist like all the other vendors do as well too. All right. Any questions on the process that have been asked that I can answer before we move on to the next slide? Okay. So as a note, vendor certification is required in Pennsylvania, and certified vendors in other states will require recertification in the PADHS. In other words, if you're certified now, you need to be recertified again. Everybody's going through this process. Okay, there's no exceptions for anyone. Vendor certification and recertification is required to submit the home healthcare services and PCS services data to the DHS EVV program. And then of course, timelines, we just talked about the timelines, but additional input and information will be provided to all vendors and provider agencies in the DHS program as updates come through. Okay, so any questions on the process? We'll get to the technical pieces here momentarily, but any questions about the process that, so let's see here. So we've got one question. We've tried to enroll some of our home healthcare agencies in Pennsylvania, and with SanData, SanData's advised that they are unable to locate our providers. At this point right now, to enroll home and healthcare services, this is a file that's going to be submitted to us by Pennsylvania when the program goes live. So right now, we are not receiving that file. So if you have home healthcare agencies that are not submitting personal care services, but are looking to submit home health care services, we'll get that file from the state as we get closer to go live. So if you're looking to do that pre-enrollment for those agencies, we do need to get that file. And the anticipation of that file is coming in the next couple of weeks. So yes, right now you can't enroll them. Please wait for the certification process to move forward for you to be able to enroll those new providers. And again, as I mentioned, we need you to go through the new provider enrollment program. So if you're a vendor, you cannot enroll your providers. The providers have to do it with this enrollment form on Friday, the 15th, starting Friday the 15th. What is alternate EVV? Alternate EVV is an EVV system that is not the SANDATA system, that is free to the SANDATA system, free to the for the Pennsylvania DHS EVV providers. So if they choose a vendor outside of the free PA DHS EVV system, that would be considered alternate EVV. When we get the testing sheet for existing certified vendors, that'll come on in your email on Friday. And some of these questions came in before I went through the slides, so I think I'll skim through those just to see that. Testing is required for every provider or for every vendor, So vendors only need to test once for all your provider clients. So if you've got 10 provider clients or you've got one provider client, you only need to test once per vendor. Okay. Programs. So how can we confirm that the email address you have to send this information to is accurate? Again, if you don't get the email by Monday, the 18th, please reach back out to the support team. So vendors, again, if you don't get an email by Monday, then please reach out to the SANDATA support team. And that's all the questions, at least at this point right now for the process. All right. So I'm going to go ahead and turn it over to Clela, who is going to talk about the specifications portion of the testing.
Thank you so much, Paul, and welcome everyone to the town hall. We're going to walk through the alternate EVV specifications in JSON, and we'll look at some common errors. Paul, you can go ahead and go on to the next slide for me, please. Thank you. So understanding the specification, we do have the PA DHS alternate EVV technical specifications available on the PA DHS alternate EVV website. So that web page is going to have a specification that is correct for all of your programs. The programs are listed here. We have our Office of Long-Term Living all the way through the Keystone First CHC MCO. There's a link that's going to be provided in this PowerPoint, and you'll be able to use that to take a look at that technical specification. The alternate EVV technical specification has been consolidated to be a single specification for all of the PA DHS alternate EVV submissions. So as you go to look at that, don't be surprised that instead of finding 3 or 4, as we've had in the past, specific to different MCOs and different payers, we have consolidated those, and we've created one that allows you to see everything that you need to do for all of your different payer combinations to take care of your business. Let's go ahead and move forward. So as part of your alternate EVV transmissions, you're going to be sending us 3 different transmissions. The first transmission is that client overview. It's part of that specification that has the 4 segments that are related for the client records. We have a client general segment. It is a required segment that we will need for every client transmission. We have a client payer segment, which is required for the PA DHS alternate EVV submissions. We have a client address. A primary address is required for every client in the PA DHS program. And we have a client phone segment. It is required for the PA program if it is available for that client. On these 4 segments, we're going to use some pieces to make sure that we are matching to the correct client information. We're going to start with our provider ID values. As part of this new specification, we've got several appendix that you will find at the end that help to give you additional guidance. The service definition appendix 9.1 will specify, based on the type of service, whether that provider ID should be an NPI, which is the National Provider ID of 10 digits, or a Medicaid ID, which would be the 9-digit Medicaid ID that is appropriate for the PA DHS system. The client identifier is, again, another matching logic that we use to make sure that we're updating or adding our client record as appropriate for that provider agency. That client identifier is a 10-digit Medicaid ID. We do some validation on those API transmissions as they come through for the clients. One of those is a matching provider ID to the credentials that have been entered. The client identifier length to make sure that it is the correct length of an identifier for this program. The client payer segment is provided as part of that transmission, and any other required segments are also included. Let's go ahead and go to the next slide. Here's an overview of what that looks like as it translates from our alternate EVV specifications to that JSON transmission that's coming from the vendor. So at the top section, we have the provider identification that's required. Again, you'll see similar language to what we just reviewed, where it does guide you to that appendix so that you can understand whether or not an NPI or Medicaid ID is the qualifier you'll send, and whether or not you're sending a 9-digit provider ID as a Medicaid ID or a 10-digit ID as an NPI, so that you align to the services provided. The client general information is that, again, required segment that needs to come through with all client transmissions, as is that client payer information. So as you have client authorizations that need to come through in this client payer information, they will need to be updated, maintained, and resent as appropriate. And then the client address, which is required. And you'll see in our JSON that we have our client phone not represented from the specification. Let's go ahead and move on to the next slide. Wanted to highlight the client payer child segment. This is a required segment that is used as a service authorization, and it's provided by the provider. There's 5 required elements for that client payer segment that is provided. This segment is not new to the program. We have been requiring the client payer segment for the Pennsylvania program. However, it has been updated as part of our home health initiative. And so we want to just walk through this again. That payer ID that's expected as part of this information is available in the Appendix 9.1 and would align to the services that are being provided for this client. The payer program information is again in that Appendix 9.1, and the service is in Appendix 9.1.1. The client status is a required field that needs to come through to let us know that that client is active. And then there are some new fields for modifier 1, modifier 2, modifier 3, and modifier 4. These fields are provided as appropriate if the service code requires them. So as it's listed in our Appendix 9.1.1, you will see those modifiers indicated if they are required as part of this information. Let's go ahead and move on to the next slide.
Certainly. Real quick note, Clella, for those of you that are putting your questions in the chat, please pay a special note that there's a question and answer section that's in the meeting. Please use the question and answer section for your questions so that we can respond accordingly. Most of the questions that are going into chat will not get responded to. So again, please look for the question and answer section of the Zoom meeting and place your questions in there. Thank you again. Sorry for the confusion.
Not a problem. Thank you so much. Yes, update on those tools. We want to make sure that we capture those questions. We will be taking those from the Zoom meeting so that we can make sure that those get handled. And again, in the chat function, that's not really designed for that. So great call out. Thank you so much, Paul. Okay, next slide. So the provider identification qualifier, now that we will be changing what provider ID is being sent through based on the services that are being provided, we do want to make sure that provider qualifier matches the unique identifier that's being sent through for that service. So in that appendix 9.1.1 for the service, you're going to find some guidance, and we'll have a screenshot of that so you can see what that looks like to let you know which of those identifiers you're going to be using as part of your payer program service combination. So for the Medicaid ID, if you are sending that as your provider ID element value, we are going to look for your provider qualifier to send the string Medicaid ID. And on the other side, if you are having your NPI provided in your provider ID, your provider qualifier will be the string NPI. So we're going to want to make sure that those stay in sync. Excellent. Let's go ahead and stop here for just a moment. We've gone through some information about the client segments that are being sent through as part of that provider agency set of transmissions. It is the first transmission that we generally receive as we're getting our alternate EVV vendor information for the provider. Any questions that we want to go ahead and address related to those client transmissions?
So let's see here. I've got a few questions here, quite a few since we've had everybody move over to chat. So bear with me here, or move over to the Q&A. So do providers receive new credentials to replace those that are in the original production credentials? No, the testing is to recertify you to make sure that all of the new additions to the current technical specifications are met. So the vendors, you will get recertified, but your providers that are currently in the program for PCS will not need new production credentials. Are there different credentials needed for NPI and Medicaid ID? I will ask that of you, Paula.
I'm sorry, say that again.
NPI.
For NPI?
Yes, just want to make.
The National Provider ID?
Yeah, I just want to get back to that, and then I'll move forward to the employee questions.
Sure. So say that question again. I'm so sorry.
Do they need different credentials for the NPI to use the NPI versus using the Medicaid provider ID numbers? So you've got.
Let me take that back to our team.
Right.
I believe that your account will specify which identifier. Actually, I know this already. Sorry, my apologies. You will not need different credentials. If you are sending NPI or you are sending Medicaid ID, it will be the same account, same credentials. All of your information will be in the same place. So you will not need a separate set of credentials. My apologies.
Correct. And to clarify one thing that was asked at the very beginning about the employee identifier, those people that are interested in understanding about the registry, please refer to Pennsylvania. The users of the registry identifier is part of the specifications. But if you're not sure whether or not the employees that you're servicing use the registry, please check with the Office of Long-Term Living and PADHS so they can inform you of who is using the registry at this time.
You're jumping ahead. You guys are getting a whole slide ahead of me. Amazing.
I'm sorry. I'm on
You're
the.
awesome.
Yep. All right, go ahead.
All right. So we'll go ahead and move on. Doesn't sound like we have anything specific on the client. I think I did see something in there asking about the telephone number that can be associated with the client.
Right.
Yes, you can have multiple telephone numbers associated with the client, including cell phone numbers, and you can have multiple addresses associated with the client. Both of those segments are child segments, which means that they can be repeated as part of your JSON. Same thing with your client payer segment. You can have multiple provider authorizations that are associated with single client. So that is a repeating segment as well that can be sent multiple times as appropriate. So hopefully that answered a few questions as well.
Sure. One other one here for client data. In the new specs compared to the current specs, it looks like the order between client address and client payer info are switched. What is the purpose of switching the order? If
there
JSONs
is no, JSON does not respect orders.
Right.
So those will be, processed as they are received, and it does not matter if the client address or client phone is in a different order. So certainly if you already have coded to this, you do not need to change your coding for that change in our specification look and feel.
Okay.
Awesome. Great. Employee overview. So we're going to go ahead and look at our second transmission that we're expecting for our alt-EVV vendors. There's one required segment for the employee, which is also a caregiver or care worker, depending on how you are using that in your particular logic for your provider agency. Identifiers that are used for that matching logic, again, like our client transmission, we want to make sure that this is in the right account, that we have this being either updated if it is a change to an existing employee, or being added new if it is a new employee that it doesn't already exist. So our provider ID values, again, align to the services that are being provided. In Appendix 9.1, you're going to specify if it's an NPI, that provider ID value for the 10-digit National Provider ID, or the Medicaid ID, which is that 9-digit Pennsylvania Medicaid ID. And then we're going to look at the employee identifier. We do have a couple of different formats for that, but we will be respecting those formats to make sure that it does fit one of our applicable employee identifier formats. The validation, we're going to look at that employee identifier length check. Again, we'll look at that here in just a moment. And then what we were just talking about. Does that employee identifier match an existing record? If yes, we're going to update that record. If no, we're going to insert that as a new record. Let's go ahead and move on. So what are some of our employee identifiers that are correct for the Pennsylvania program? So we have 3 formats that are acceptable. One is going to be the PA-DHS unique registry ID, 6-character alphanumeric value. This is required if an employee does have a PA-DHS unique registry ID. So this is really going to be a registry ID that's applicable to that OLTL consumer-directed model employee, as well as if it is instructed by your particular department within PA-DHS or through your vendor. So please, take a look at the information that's being provided on whether or not that's going to be a unique registry ID, and reach out if you have any questions. Paul's already mentioned that. I've mentioned it again. By all means, we're open to having some information available to you. The second is going to be the vendor-specific employee identifier value. This is going to be the more common and preferred format. It's a 2-character vendor-specific prefix. We do have employee identifier vendor prefix codes in our Appendix 9.4. Like I said, those appendixes have a lot of additional information that can support you. And that is in that PA-DHS vendor specification. You're going to concatenate that 2-character vendor-specific prefix with the vendor systems identifier for the caregiver employee. These 2 values, with no separation between them, will create that unique identifier for the employee. It's going to be 7 characters of any type for that vendor systems identifier. So you're going to end up with a 9-character total vendor specific employee identifier value. So it might be something like AA 1, 2, 3, 4, 5, 6, 7. Finally, our last option is going to be that last 5 digits of the Social Security number, and it will come through with the leading 4 zeros, so it would be 000, and then those last 5 digits of the Social Security number. This value is discouraged because we are finding a high occurrence of duplicate caregivers, and it does cause rejection of the employee transmission. And we do need to have that successful employee transmission in order for us to go ahead and process your visit data. Whatever employee identifier you are sending through as part of this employee transmission must be the same that's used in your visit general segment. Same thing for with the client. Of course, that's Medicaid ID. That should be a pretty common value. But again, we need to make sure there's parity and we can find that client and that employee in that provider agency's account as we are processing the visit general information. Great, I'll go ahead and take a quick moment. I think we did have a question earlier about being able to register your vendor for a vendor prefix code. I would ask you to reach out to our Alt EVV support lines and work with Sandata to get that registration. Anything else related to employees that we need to talk through, Paul?
No, I'm looking through. I think a lot of people are looking forward for a couple of other items here, but I don't see any other than that. And of course, make sure you've reviewed the specifications for that that prefix. If it's, if you've done so and you don't see your vendor on there, then please do reach out to the support. Yeah, I don't see any more on here.
Great.
We can move on.
Excellent. So now we're going to take a look at our visit transmissions. So our visit transmissions do have one required segment and 3 conditional segments. Conditional means that at times it may be required based on the changes that you're making. And at times it may be a segment that's not needed because of a different circumstance in which we're sending that visit information. So that required visit general should be on all transmissions. Calls would be associated with the call data that's being transmitted for that visit, especially on that initial submission of that visit transaction. The visit exceptions acknowledgement will only be sent if there is an exception that must be acknowledged through that visit transmission in order for it to be cleared in the PA-DHS aggregator and for that provider's visit to get into a verified status. Any visit changes will be requiring a visit changes log as part of this transmission. That is a segment that will be sent through anytime that you need to make an update to a visit. So identifiers used for matching logic. Again, we want to make sure this visit is in the right place. We're going to use the same provider ID values that are referenced in Appendix 9.1, either NPI or the Medicaid ID for Pennsylvania. The visit other ID value, this is an important value. It's the ID from the vendor system for the visit. This same value must be consistent for all the submissions for that individual visit. So it will be how you would make changes to that, how you would acknowledge exceptions. It is associated with any adjustments that might need to be made. And the client identifier, which is that 10-digit Medicaid ID, and the employee identifier we just talked about in the previous slide. Make sure that you're using a consistent employee identifier in all transmissions to update that employee data or for any visits that are associated with that employee. All right, we'll go ahead and move on. So for our visit overview, we do have a new required field for that calls segment. So in that calls segment, there's a visit location type. This new field specifies where that service was rendered to the member by the caregiver as either home or community. It is required for all of our call types: mobile, telephony, FVV, or manual. And this is what it looks like in that specification. You will see that it does say that it is required. Group code. Group code is a field that we've had for quite a long time. This field is for all of our visit segments. It should use the same code, the same 6-character or up to 6-character identifier. And what this does is it links one visit to another. So if we have a group care situation, like one caregiver to multiple clients or multiple caregivers to a single client, this group code is used to group those visits together so that we'll be able to identify those as we do our claim snatching, as we do all of our reporting for the Pennsylvania State Department. Let's go ahead and move on. So procedure code validation, we are going to do validation to make sure that the payer program, procedure code, and applicable modifiers match in the valid record that's defined in the specification. So remember that Appendix 9.1.1, we're going to be looking at that to make sure that we have a service that is defined there with the correct payer, program, procedure code, and modifiers as stated in that specification. Client identifier must match to existing client record in the state feed and be loaded to the agency's account. So again, we have to make sure that that visit is for a valid client in the Pennsylvania Medicaid system. And so we will be using that Medicaid ID of 10 digits. It must also be associated through the state feed with that provider agency. Same thing for employee. That employee identifier must match an existing employee record within the agency's account. So we'll need to make sure that we have that client available from the state feed and the employee loaded as part of our transmissions before that visit is going to be able to pass our validation. Optional segments that are required based on that condition for the segment. Again, like we talked about, you have now transmitted one visit. You've made an update to that visit record. Perhaps it's an adjusted time. You resend that visit transmission. We are going to need that visit change segment. It will become required under those circumstances. Great, next slide. So our calls segment has got a couple of other things we wanted to just point out. So other is no longer a valid call type or call assignment in the PA-DHS EVV program. So what are valid call types? Mobile, telephony, FVV, or manual. We will need to specify one of those particular call types as part of that transmission for the call segment. The call assignment is going to be either a time in or a time out. We no longer have other for extraneous calls. Also new are FVV in the call segment. When that is your call type, there's going to be a conditional call latitude and call longitude that will become required. So those fields that were not required previously have now become required for FVV calls. So following our existing logic, just to remind everyone, in the call segment, if you're sending a call type of mobile, call latitude and call longitude have already been required fields. And for telephony, you do have some conditional fields, originating phone number and telephony PIN, that do become required based on that call type of telephony. Let's go ahead and take a quick pause here. Any questions that we want to answer related to visits, call segments, new fields that are coming through?
So I do have a question from a vendor asking if an agency is using NPI and then also the Medicaid provider ID for home health care and PCS services, how do they know, how to send those?
So again, it will be the service that you are sending through.
Right.
You can use Medicaid ID on your client transmission and your employee transmission. It really becomes critical when we're looking at the visit transmission that those be associated with the correct one.
Okay. If going back to employee, the employee identifier, we have a vendor who has gone through a merger acquisition, which has then caused their prefix to change from one to another. Will that what will be the important things for them when they switch over to use the new prefix? My thought is obviously for visit changes, they'll have to go back to the old prefix if they change to the new prefix. So yeah, let's say you're sending as AB, as your prefix, but you've now been acquired and your new prefix is BC.
Yep, I understand. I definitely think that that's kind of a tricky situation, and I'd like to go ahead and take that one offline with that particular vendor so that we can talk through some of those implications. You're right, we will need to have that employee kind of referred to as it was at the time of the visit for us to be able to make those updates.
Okay.
So,
So that would be a support
have
question.
a deeper conversation with our support team and that particular vendor so that we can, try to work through that. Great question. Absolutely great question, but probably deeper than we can go into today.
Right. So visit location type, can it be used right away, or is there a start date?
Visit location type can be sent through now. That information will be accepted and at the same time will not be required just yet. So you can start making the modifications to your submissions based on the updated specifications right away.
FVV, someone is asking, that's fixed verification.
Fixed visit verification. Yes, I'm sorry. FVV is a device that would be in the caregiver or client's possession and would be used to be able to validate that electronic data related to date and time specific to those transactions.
Okay, let me just review. Just for a real quick note for everyone on the call, if you are a client of HHA Exchange and you are new, we will work with HHA to get you certified. So again, for only those people that are working with HHA Exchange, the new process and certification processes, you will be going through HHA. That is a little bit different. We didn't talk about that earlier in the process. So yes, HHA Exchange agencies just need to work with HHA, and we will work with HHA separately. So again, a little different for them. So we have not done EVV. So our first step is to enroll as a new provider on April 15th. That's correct. Let me go through. If a call type starts out as mobile, then is manually verified at the office to a different time in and out. Does the call type stay mobile with the adjusted times filled out with the actual corrected times?
That is an excellent question.
Right.
Yeah, and one that we hear often. So yes, the correct way to go ahead and submit that visit is going to be to send the visit segment, the visit general segment. You will put in those adjusted in and out times as part of that visit general, and send us the call information for your in or out or both calls as they are available. So we will expect you to be sending through all of the electronically collected data and then any adjusted in and outs that are needed as part of that initial transmission. And then you would not need to be sending a change log in relationship to it, as the data would come through with all that information at once.
Okay. Are vendors allowed to transmit an exception code in the first pass transmission if we are able to validate the JSON?
I will take that question back and we'll get an answer and we'll post that because that's a great question. All right.
Yeah, go ahead. There's a lot of questions. So I just want to see if I can pull any quick ones out here.
In the interest of time,
yep, go ahead.
We're at about the right place where we probably do need to go ahead and move on. So I'm going to do that and we'll circle back around if there's some of those that we have time for at the end.
Sure.
Okay. Services and modifiers. So this is what you're going to be seeing as kind of a snapshot from that appendix 9.1.1 that we talked about. So you'll notice that at the top it says payer programs, services and modifiers. Payer equals PA, ODP, PCS. Use MPI only. So again, we are providing that guidance as part of that appendix to make sure it's clear what the expectation would be for that provider identifier. And you'll see right below that where we do have that ODP HHCS services would be using NPI only. Okay. The service list here is only for example. We have all of that in our alternate EVV technical specifications that are located on the PADHS alternate EVV webpage. Definitely, if you have any questions, take a look through those appendix. They're laid out really nicely to be able to identify modifiers that would be required for that to be a valid payer program service modifier combination for the services that are being performed. Let's go ahead and move on to the next slide. Visit exceptions. So exceptions do ensure that data alignment to the program. The exceptions target cures and that are required for compliance. So we're going to have unknown client that is going to require a client be associated with that visit transaction. So in the case of alternate EVV, we use that client identifier as one of our validations of the visit transmission. Therefore, an unknown client is not an exception that would be viewable in the PADHS aggregator for an alternate EVV transmission. In other words, we don't let it through the front door if we don't know who that client is. So that will need to be fixed on that visit. You'll get a rejection of the visit right up front. Same thing for unknown employee. We talked about how important it is to have that same identifier for the employee. It will reject as it comes through the front door if we aren't able to match that employee to an employee that's in the provider agency's information. So unknown client, unknown employee, you're not going to see. Same thing with our very last exception, which is missing service. We need to know what service was provided, and we validate that against that service list that we just took a look at in Appendix 9.1.1. If we do not have a valid combination of payer, program, service, and modifiers, then we will reject that visit again right at the front door to say we can't match that up with the PA program requirements. So that gets through at least a few of these exceptions where you don't need to worry about acknowledging them, just fix it and resubmit. Same thing for visits without in-calls and visits without out-calls. If you submit a visit and it is accepted, because again, if you're just sending changes to a visit, we do allow you to submit a visit without the in-call or out-call. And you can come back through and you can fix that afterwards, not a problem, but you will need to send that visit changes segment so that we can go ahead and make sure we have all the documentation and tracking as to why that call segment was not there in the initial transmission of that visit data. The last one, unmatched client ID phone. This is one that would require that acknowledgement segment. It's the only one that requires that acknowledgement segment. So if we have an unmatched client ID phone for a telephony visit that was not related to a phone number that's in that client's records, that's when you're going to get that exception, and that's when you would need to submit that acknowledgement segment. So again, most of these are going to be things that will reject right up front or require us to have that change log or require an acknowledgement in order for it to be in what's called a verified status. All of the information for location error or all of the information for error handling is available on the PADHS website. We've got that website link here for you. Let's go ahead and go to the next slide. Okay, I'll stop there for a moment. So we went through quite a few different things. We talked about the verified status. Quickly, that verified status is crucial to doing claims matching for your providers. So while not a topic necessarily here, as a EVV vendor, someone who is providing that collection of EVV data as a service to a provider agency, you want to make sure that you help them to have all of their claims match. And to do that, we need to make sure we get all of that information coming through. Paul, anything that's come up that we want to go ahead and take a few moments?
Yeah, we have quite a few things here, and I'm trying to, I found one really good question, but the start of his question says previous to his former question, and I'm trying to find the previous question. So, but I will talk about the payer regions. If the person that posted in about the payer regions, if you're talking about the payer code, those have changed. So take a look at the specifications to make sure that you see that those have changed in the specification. So I'm trying to find the additional payer program. Yeah, payer program has changed. Let's see here. Canceled visits. Can we just talk a little bit about the canceled visits again, Chloe, the importance of those?
Sure. So, you know, there are times when you have EVV visit data that gets collected and is never brought into a verified status because the visit didn't actually happen. The caregiver got there, they logged into their application, they got started, and the client wasn't home, or there was an emergency and that particular service was never performed. And so there could be that visit that is out there that really is never going to match to anything. We do give you the ability to send through a element called omit, and that will allow you, I'm sorry, not omit, it's got a different name. Shoot, I'd have to look it up. But
Cancel
we do have
indicator?
a bit, yes, visit canceled indicator. Thank you.
Yep, bill visit and then cancel indicator, yes.
That one will allow you to go ahead and remove it from reporting, and it will indicate in the system status of omit, and that's why it was on my brain. And so you will be able to take that out of the reporting and acknowledge the fact that that particular visit is never going to have all of the elements needed in order to be in a verified status. It is not eligible for claims matching when it is in that state. So you really need to make sure that you don't change that state unless it is required. And we'll do a better write-up on this. I know we've got some through our support teams. So please reach out if there's anything that you're not clear on. I think there may be a second corresponding element as well that we would be referencing.
One question about acknowledgements being required when submitting exception codes. I think they need to refer to the specifications for those, correct? Are acknowledgements required when submitting an exception?
Right. Yes. So that is going to be part of our specification information in our appendix. However, again, that only one that requires that acknowledgement that we just went through is that unmatched client ID phone. So if we have a phone that a telephony call was originated from, that was not part of our client records, that's when we're going to go ahead and need to send that acknowledgement.
Okay, and I've had this a couple of times, so I apologize if I didn't make this clear at the very beginning. We are recording this session, and we will provide the link as well as the PowerPoint from today's session to Pennsylvania to post on the PADHS website. So if you missed anything, please, by all means, go to the website, and they'll be posting that on the PADHS EVV website. Let's see here. I think that's it for now.
Awesome.
I'm sorry, validation on visit location. Will there be a validation? Let me get that one, and that one is important. Will there be validations performed on the visit location in the visit transmission and call longitude and latitude with addresses submitted in client transmission?
That information is reportable by the state. So yes, we do allow that to be something that the state will have available for reporting. But it is not something that there will be an external validation.
Right.
We wouldn't have that ability to go through and externally validate.
Okay. All right. I think that's it. I don't see any others last minute coming in.
Awesome. Well, good. We're right on time. I wanted to be right here at 12 o'clock. So my time, 12 o'clock, I'm in Mountain. So thank you. Common support issues. So invalid credentials. When we have a rejection of a transmission that says request contains the following providers that are not authorized for the given account and credentials, you will need to contact SanData support, and they will help to make sure that you have the correct and are using the correct credentials as part of your transmissions. Let's go ahead and move on.
Oops, jumped too many.
Client, ooh, nope.
Sorry.
You're perfect.
There we go.
So error code 1021, client not found. This happens when we have a client that is not in the agency account. The client JSON failed to be created, or the transmission of the visit data was done with an incorrect client identifier. So if we have a client identifier on the visit transmission that doesn't fit the identifier on the client transmission, what can you do to troubleshoot? So because your clients are coming through the feed and should be preloaded to your account agency, if your client record was rejected, you're going to want to make sure that the state aggregator has that client record as being successfully added to that agency account. So again, we will take the client transmission that is provided, match that to the information we have on that state feed, and populate the provider agency account. So if you do not see it there, you're going to need to go ahead and check our aggregator, make sure that you understand what's going on, or reach out for our support team to help. Also, do make sure that you're using the correct client identifier. In other words, make sure that what you've sent in both your client record and your visit record match, and then ensure that you have that right format. It is 10 digits. It is required to be 10 digits. Let's go ahead and move on. Worker not found. This is error code 1031. Again, that employee is not properly specified. So the employee identifier that was sent is not the correct format. So perhaps we had an identifier that came through to us in the employee transmission as 0000 with the last 5 of the social. But in the visit information, we have the vendor prefix code and the vendor ID. We do need to make sure that those are the same identifier, and this goes back to the question that we're going to go and get some more information and help here. We do want to make sure that that employee identifier is correct for the visit and for the account.
Right.
What can we do to troubleshoot? You are going to want to check again that aggregator to make sure that employee record was successfully added to the provider agency account. And then check those technical specifications for the available formats for that employee identifier. We do need to make sure that those links for the employee identifier are respected. That is one of the validations we'll do right up front. And then contact the Alt EVV support for additional troubleshooting, or go ahead and do some visit maintenance to correct that employee identifier and just resubmit. And then that visit should be accepted if it matches that employee record. All right, let's go ahead and move on. So for error code 553, this is error during retrieving service ID entered. So we do have to have a service associated with the visit. We will not accept a visit record that doesn't list that service. The visit has to have a correctly formatted service as well. So if you are getting a rejection for this and you have what is a valid service, please let us know. We can go ahead and do some investigation on your behalf, but you will need to make sure that service is in scope for the program. So as soon as those service codes that are related to home health are being submitted, if there's any problems, definitely reach out and we'll work with you to make sure that you have that properly specified. It will just be visit maintenance to correct that on behalf of the EVV or the provider agency, and then just resubmit that to add that service code or correct that. Let's go ahead and move on to the next one. So another flavor of this. So we can get a 553 error during retrieving service ID entered if we have modifiers or services that aren't using proper case. So we do require that they be in that upper case as they're being submitted with your transmission. They are listed that way in the specification. If you follow the specification, you will have the right combination in the right case. Again, it is also combination sensitive. So as we've pointed out in the second example, a W7060U4U1 is valid, but if you submit it as a U1, U4 in your modifier combination, it is not. So we will be checking for, again, case and that order for those modifiers as they come through. So keep a close eye on the specifications until you kind of have all of those coded so that they're successful as part of your certification process. If you have any questions or any problems, definitely reach out and we will help to do any kind of investigations needed. And then just as you do find anything that's incorrect, that's visit maintenance to correct or add that and then resubmit. All right, next. So some best practices. We've talked multiple times about how important it is to have that validation of the information that's coming through. And one of our big validation is that that client is part of that provider agency's records and that the employee is part of that provider agency records. Our best practices are to recommend that you send all of your client member records first, or all of your incrementally changed client and member records first. Again, not necessary to resend those every single time, but as you have additional clients or updates to client data, we would expect those incremental changes to be sent as your first set of transmissions. Then check that status. Make sure that those clients loaded successfully. And then generally what we recommend is now send your employee caregiver records, right? Make sure you have all of the updates, send everything that's new from your previous transmission. So on a daily basis, make sure you're grooming that and you're getting us the most current up-to-date new employees or updates to employee information. Again, check that status, make sure it's loaded successfully. When you've got a successful load for clients, successful load for caregivers, you are ready to send those visits. Mm-hmm. So continue to send those visits on your defined schedule. Send those new clients as they're created, send those new employees as they're created. Make sure that those existing records get updated in a timely manner as well. All right, let's go ahead and move on to the next slide. Mm-hmm. So I'm going to stop there for a second. Those are some common basics that apply to all alternate EVV vendor transmissions with SANdata. So if there's any questions that are non-PA specific, that's kind of a section that was a little more general. Is there anything else that I need to clarify there?
Sure. So there are questions coming in, and again, I just want to just make a quick note to everyone. We get a lot of questions that are coming in, and a lot of questions are coming in before some of the areas that we're talking to them. So it may not be that we are ignoring you. It's just we may want to get to that section, or we're seeing that question over and over again, and we will do a mass communication, as I mentioned at the beginning, through the FAQs with DHS. So again, just for people, we've had a couple of people mention, you're not answering my questions. However, we may be ahead of the game here in that question, so we may be waiting, or also it may be a question that's been asked for from other vendors, and we'll be providing that response in a mass communication, or it could be very specific to your vendor as well too, so that it's probably not something that we should answer on this meeting, but we could answer in a support ticket for you. So again, we thank you for your patience at this point right now. In terms of the certification, there's a couple of questions about certification. Again, there is documentation that's on the PADHS website for the recertification as well as the new vendor certifications. If you refer to that QRG, that quick reference guide that's on there for the new vendor as well as the recertification, it will walk you through all the different steps and the expectations of the testing timelines, as well as all the different call outs are in the specification. So please make sure that you're reviewing the specifications as well as those quick reference guides, because a lot of questions that we are seeing will be answered for you in those quick reference guides as well as the specifications. So let me move on to a couple other questions here. What about a failed exception? Any plans to make that easier to troubleshoot? Not sure if I understand what the...
So yeah, visit exceptions, again, we've done our best to try and pre-validate as we have things coming through that front door, have to have a client, have to have an employee, have to have that service, to do our best, again, to make the system flexible enough that you can do visit changes and updates without having to have call segments. The visit without in-call, visit without out-call, again, might require a resubmission of that visit data so that we can clear that exception, not requiring an acknowledgement.
Yeah.
That really leaves our client ID, unmatched client ID phone. And that is not an exception that we calculate as that visit is being loaded into the system. It's something that's calculated post that particular point. And so we do make that available to the provider. Honestly, it is the provider's responsibility to be checking that their visit data is correct and for them to go back in and make those updates that are necessary. So they should be doing an acknowledgement in that EVV vendor system to resubmit.
Whoa. I jumped way ahead of you here.
Whoa.
Yeah, where are we at here? Sorry.
I did want to mention that we had the question about omitting a visit that had been submitted. And I do have some elves in the background who are double checking for me. Visit canceled indicator is used when we're doing scheduling. And so that particular one would apply to a schedule that had been transmitted, but is not related to omitting an actual visit. So there is the bill visit, and bill visit is going to be the element that you would send through. So bill visit true, going to show up for everybody to do reporting and for claims matching. Bill visit of false is what's going to remove that from your provider agency's reports and the aggregator reports of the state.
So I have a question of if an LTV vendor fails, is there a process to follow? So if your vendor fails their checklist, they will need to resubmit it until it passes, essentially. So the process essentially is if they submit their testing checklist, San Diego Support EVV will, PA Alt EVV support will respond that they may have failed it or they did fail the checklist. We'll provide them with the segments that they need to correct to pass the checklist, and then your vendor will resubmit that checklist as many times as it takes for them to pass. So there really isn't a process other than the fact that they just need to resubmit it over until they get it right.
And we do, thanks, Paul, that was perfect. We do work really closely with the alternate EVV vendors to make sure that they have whatever support they need to be able to get those passing. We've got a great team that will help to make sure that those changes are clear.
Somebody's
Anything
asking
else,
about, yeah, somebody's asking about IDs changing for payer, client, and employee. How are they supposed to handle the the in-flight records? I don't think that the payer the IDs are changing. So I think we want to just clarify that for this individual that, you know, they're asking about the IDs changing for payer, client, and employee. So again, the employee identifiers are the same as they are for PCS. The client identifiers are the same because we are receiving those from this state, and the payer IDs are all the same. We're just clarifying and breaking the specifications out to be able to read more clearly.
Yep, exactly. So we're not asking for new identifiers. These identifiers have been in use for the program and should be consistently used moving forward. So there shouldn't be changes to that. Again, these are just common issues that we come across as part of the information we do investigation on. We want to highlight those to make sure that they're clear for everyone, what the expectations are, and be available to answer questions as you need them.
One last one, and let you move on here and correct my scroll buttons, change the slide so you can tell me where we're at. Can we as a vendor get access to an agency aggregator account so we can assist in troubleshooting? That's between you and your client. You as a vendor, we cannot provide you access to the aggregator. As you can understand, there's PHI and so on. Now I understand you're providing us that PHI, but access to the aggregator, you need to work with your clients to be able to gain access to their aggregator, because those credentials are to the agencies, not the vendors. So for those people asking about agency aggregator accounts, again, please work with your particular client agencies to gain access to their aggregator account.
Thanks, Paul. And again, it is the provider's responsibility to check that that visit data is successfully in the system and that all of those exceptions have been cleared.
Okay, perfect. I apologize, I scooted forward here.
You're good. We got through integration best practices. We're on the next slide. Perfect.
Nope, because we're under the thank you slide here, so I apologize.
All right, so services requiring multiple caregivers. We did want to take just a moment here to talk about that. So services that do, as part of the service rendering for the member, require that there be multiple caregivers. We would expect individual EVV visits for each of those caregivers, whether it be telephony or mobile or fixed, FVV, fixed visit verification, or even manual. But we would expect there to be 2 visits that would come through indicating the same client and the individual caregiver, the employee information for those individual caregivers as part of that visit transmission. Each of those visits is going to be required to be in a verified state. So it needs to be in the SANDATA EVV aggregator. It is going to need to be with all of those exceptions. So it's got to have, what time was the service performed, what date was the service performed, what was the service that was completed, the employee identifier and that client identifier in order for that to be coming through properly. Finally, that status for the collection of those visits will be used then to do that claims matching. So we will look at multiple visits as a way for us to satisfy that condition during our claims match. So any questions on the multiple caregiver services?
I do not see any.
Okay, great.
Let's see. Oh, we'll give a second here. Let's see, one just came in. Here we go. If 2 caregivers check in at different times, then which times are utilized? They'd have to check in at the same instance, otherwise it will not reconcile. No,
they do not need to check in at the same instance. So we will be looking for care that was provided, but overlapping. So again, we'll look to make sure that those times are within the same time range as would be acceptable. So, we would expect that there's going to be a start time and an end time, and there should be 2 visits that match, approximately that range. And those are going to be specified as part of the claims information that comes through, so that when we're doing that matching, we have that information. But it's not instantaneous. It does not have to be exactly the same moment.
Any other questions coming in? Let's see, they're slowly coming in again.
All right. We'll go ahead and move on to the next slide, and then we'll take a look and see if there's any other big themes here. So support resources. So this is great. Town halls are awesome. So fantastic. And you guys have a whole team around you. First place to look is going to be that PA/DHS EVV website. It's fantastic. It's got resources that are available, error guides. It's got that quick reference guide on how to get started, right? It's going to have information about the certification, the recertification, and it's going to have those alternate EVV specifications. So definitely your first stop is going to be that PA/DHS EVV website. Want some more information, want to understand a little bit better, there are some learning management system opportunities that are there, especially oriented towards our provider agencies. Again, vendors have their own support that they have through our PA Alt EVV support team. Happy to work directly with those vendors, but we do have additional information for the providers on how to access the aggregator, what those aggregator statuses mean, how it is that you need to resolve those. So please check out our learning management system. Awesome. I really am pretty much there. We've got about 10 minutes left. Any big themes that we want to go ahead and address, Paul?
Yeah, let me scroll back through. The questions have slowed down a little bit here, so bear with me here. A couple have come in. Evan, you'll probably need to ask that one of your program office, the last question that just came in. So that would probably be program specific. Let me roll through here. So yeah, I think most of the questions have been either addressed or are common themes that we will answer in follow-up. Let me just really go back to the very beginning of this presentation and just put the milestone dates back up here and just reemphasize again that for the vendors that are currently providing services in the DHS EVV program right now, you should be getting an email on April 15th. Everybody that is a contact within your vendor agency will get an email. Again, the vendor will get an email. If there's 4 people in your vendor organization that helped with certifications and implementations, you all will probably get that email. So if there's only one of you, then obviously only one person will get that email. So be on the lookout for that, and that will contain all the testing criteria information. There's a lot of questions about what's going to be on the testing criteria and so on. That will all be contained in that email to you. Again, get started testing as soon as you get that email. You will only need that one email. And again, the documentation that's on the website for the quick reference guide, the QRG, the error handling guide, as well as the new technical specifications on the website are your friends. So make sure you're downloading those documents as we speak, if you've not done so already, to make sure that you've reviewed those and are prepared for that email to come out on Friday. Again, new vendors, you can start certification as soon as a provider reaches out to us and enrolls with us. If you're new and you already have a new you are new to Pennsylvania and you already have providers in the program, that provider is also going to need to reach out to us to indicate, hey, I'm switching vendors from X vendor to Y vendor. The Y vendor is a new vendor to Pennsylvania and they need to start testing. So we will need them to start that process. So again, just as a reminder, these are the dates that are looming on this Friday. You'll be getting those credentials. And again, this Friday, new providers can go out online and start the enrollment process to get started getting their credentials. And I think I want to thank everyone for taking the time. There was a very large attendance on today's call. If you have any questions or you want to review the material, we'll be providing the link to Pennsylvania to post on their website, as well as the documentation from this call, as well as we have a follow-up town hall, which the content will be the same. But if you didn't get your question answered and you want to ask a follow-up question as you're doing the testing, you can join us on that May 23rd town hall coming up in the next couple of weeks. So thanks again, everyone. Appreciate your time, and we will reach back out to you, and I'll talk to you again very shortly.
Thank you all.